meeting. As we are gathering here today, I am seeing people join. Thank you so much for being here. And I, at this point, am going to turn the morning over to Jennifer Maddens, Washington Group Chair, to welcome everyone and kick off the second day of our meeting.
Thanks, Julie, and welcome everyone to day 2. Thank you for joining us again, and thanks everyone for such a good session yesterday. So, next slide, please. Just a couple of housekeeping reminders before we start. Please introduce yourself in the chat every day. Again, this is the only way that we can keep track of who's attending and who we might want to get back in touch with after the meeting. Since for reasons we don't have to go into, it is very hard for us to do RSVPs for these kinds of meetings. Mute your microphone when you're not speaking. When you are presenting or asking a question or participating in any way, please speak slowly and into your microphone. This really helps our interpretation team, who, as you know, are absolutely fantastic, but we'd like to make this as easy as possible for them. So speak slowly. I know I didn't do that yesterday, so I'm going to try to do better today. And thanks everyone for doing that. Please make use of the chat box. We invite questions and discussions. You can always raise your hand. We're happy to have verbal interactions, but if not, the chat is fine. We will be monitoring it, and we can read your questions for you. And then, as you've heard, the session is being recorded. And we basically have 3 components to today's meeting. We're going to start with an update on where we are on the inclusive education module. Yesterday, you heard about all the work that is being done on the CFMTV and testing it and getting it ready for release, but along with documentation of how it should be used and what people might need to be concerned about or notice about when they use it. Hopefully in the next year, our partners who presented them will work with the Secretariat to kind of come up with some kind of document that summarizes all of those results, so we can look at comparability and differences, and at some point come to a consensus document about what we know about the CFMTV. And Claudia mentioned that yesterday, there would be a meeting about that. Claudia Kappa from UNICEF, who you all know, will also be our presenter today to talk about the other major initiative in the area of child disability and education, the inclusive education module, which you have heard about before, has been in the works for a long time. And we hoped, again, as was the case for the CFMTV, to be able to kind of bring this work to a close and provide a tool that others can use who are so committed to improving education opportunities for children with disabilities. So I'm going to turn this over to Claudia to give this presentation. Remember, questions in the chat, and hopefully we'll have some time at the end where we can discuss the really intensive work that's gone on to get this module where it is. Claudia?
Good morning, everyone. Good morning, Jennifer, and thank you so much for giving me the opportunity to provide updates on this module. Indeed, we have been working on this module for over 10 years, so we are ready to stop the work. We have done our best. Of course, it's a very complex topic for a number of reasons. Measuring the environment in itself is very contextual, so we needed to develop an instrument that can be incorporated in very different contexts, right, where the education system is different. And also we wanted to do so in a way that can be used and integrated into multi-topic household survey. So keeping in mind the main considerations when it comes to collecting data through household survey. So let me give you a quick update of where we stand. So in terms of basic principle, for those of you who have not been exposed to this work earlier, it's meant to be an extended set of questions that focus on formal education and environmental factors that influence participation of children in schools. The questions are addressed to mothers or primary caregivers of children of school age. So of course, countries will need to customize what the school age is, whether it starts at age 5 or at age 6. We are not capturing early childhood education, so it's the official start of the formal education at the primary level. The idea would be to add this set of questions to multi-topic surveys. But of course, these type of questions can also be incorporated into dedicated surveys on education or dedicated surveys on disability. The main objective of this question is to help understand the barriers that children with disabilities may experience. And of course, for this question to do so, the question needs to be used together with the child functioning module, because the objective of the child functioning module is to identify children with disabilities. So we have to identify our population of interest through the child functioning module. And then when the question on educations are included, that are part of the inclusive education module, we can then disaggregate the data that we collect through the inclusive education modules, depending on the disability status of the child. So going back to the international classification of functioning that represent the backbone that we've used to develop our data collection instruments, as you know, the UNICEF Washington Group module on child functioning focus on the activity limitations. So looking at the ICF, the CFM focus very much on capturing the limitations in the activity that the child might have as a result of this interaction between his or her impairments and the environment where the child lives. The inclusive education module focus more on the participation restriction aspect of the international classification of functioning. But of course, with the understanding that we look at the school environment and education as one of the different environments and spheres of participation where children are expected to be able to thrive. It took us 10 years to develop on this module because, of course, we also went to the field and did testing on the draft set of questions. We have done cognitive testing in Jamaica, India, Cambodia, Kazakhstan, USA, and most recently, Brazil. And I want to take a moment to thank all the teams that have worked with us across these different countries to test this set of questions. In particular, I want to take a moment to thank the Institute of Geography of Brazil, because they have been most recently engaged into the testing of the inclusive education module in Rio de Janeiro, and this happened as recently as August of this year. We have been able to look at the results, and thanks to this specific testing, we have been able to complete the work on the inclusive education module. We have also used questions from this set and tested them in Azerbaijan, Malawi, and Kosovo United Nations Security Council Resolution 1244. We call it a set of questions because there are different types of modules that actually needs to be implemented. The original idea was to develop a short module, but we realized that before we can implement questions that try to understand the school context, we needed to start by understanding whether or not the child was in school, the type of school and classroom that the child is attending, the type of participation that the child has the ability to enjoy. So the first module in this set of questions is a module on school participation and school type. Then there is a second module on school environment, a third module on reasons for not attending school, and a fourth module on school attendance determinants. And I'm going to give you explanation about the content and the eligibility requirements for each one of these modules. Let me start with module number 1 on school participation and school type. This module includes 14 questions. These questions are meant to be answered about all children and cover different topics, whether the child has ever attended school, the highest level and grade, attended and completed. The module then asks if the child is currently in the current school year attending school, whether the child has been repeating a grade, whether the child is is homeschooled exclusively or in combination with going to a physical school. Then there are questions about the type of school and the type of classroom that the child is attending, whether, for example, it's a boarding school or a regular or special school for children with disabilities. The module also asks about the number of school days that have been missed and expectations of the mothers or primary caregivers about the child's ability to complete the school year. Thanks to this module, we then determine the eligibility for the following modules, depending on whether or not the child is currently attending, whether the child is out of school, and whether the child, for example, is homeschooled or is attending, but not for the majority of the time. So the second module is intended to be administered to mothers or primary caregivers of children who are currently attending a school, a physical school, and they are attending systematically. It includes 20 questions which cover the following topics: whether the child needs help to get to school, whether the child is receiving support from school staff. There are questions related to the availability and use of learning materials, conditions of the classrooms, including, for instance, temperature, availability of desks and tables, light and noise level, accessibility of wash facilities, and accessibility of recreational areas at school. There are questions about safety and acceptance by other peers about the child, responsiveness of school to concerns from parents and primary caregivers, whether the school meets the student learning needs, and the ability of teachers to meet the students' learning needs. Again, everything filtered and communicated to us through the perspective of the mother or primary caregiver. The third module is intended to be administered to mothers or primary caregivers of children who are not currently attending school. These include children who have never been to school, as well as children who were in school in the past and drop out of school. It includes 13 questions covering the following topics: whether the child was denied enrollment, questions about the conditions at the school, which might be the reason why the child is not currently attending, lack of adequate transportation, safety concerns, accessibility issues, lack of assistive devices or support services, and teachers' inability, for example, to meet students' learning needs, or unfair treatment by teachers. As you can see, these questions try to understand if any of those factors could be one or the main or reasons why the child is currently not attending school. The last module is a module about school attendance determinants. Is meant to be administered in the case of children who are homeschooled exclusively, or, for example, children for which the mothers report that this children has missed most of the school days. It includes 11 questions covering the following topics: whether the family has financial constraints, whether the child needs to work or take care of family members, whether a child is married or about to get married, whether the child is about to have children, or whether the child has a serious health condition or is considered too old or too young to continue in schooling, whether the child has completed enough schooling or is not interested in schooling as per the perspective of the mother or primary caregiver. And the last question is about expectations related to future earnings, because parental expectations about, for example, the usefulness of the school might affect parents' motivation to send their children to school. So this is a schematic representation of the content of the inclusive education set of questions. So as I mentioned earlier, there are 4 main modules, and the first one applies to all children. Then the other 3 modules apply to children depending on their participation in school, whether they are going to school or not going to school or being homeschooled exclusively. The questions obviously try to capture all possible categories of children. So children who do not attend because they never attended, or they attended in the past but drop out. Children who are currently attending, but in this category, of course, we might have children who are going to a physical school and children who are only schooled in the home. Those going to a school might be going regularly, might miss most of the school days, but might attend regularly, but at the same time, there is no expectation that the child might complete the current school years. So we are really trying to develop a set of questions that can provide insight into the reasons affecting participation and successful completion of schools for children. It's important to underscore that this module is not only meant to be administered in the case of children with disabilities. The module is meant to be administered to all children with and without disabilities, and can also be very useful to understand, for example, reasons for being out of school in the case of children from certain minorities or children, for example, of a certain sex, like boys versus girls, for example. So it's not exclusively meant to be used in the case of children with disabilities. But of course, when we use this set of questions, and then we are able to identify the population of children with disabilities, we can then see if in the case of children with disabilities, certain indicators operate differently than in the case of children without disabilities. Now, I just wanted to mention one thing before we move forward with the next step, is that the original module also included a set of questions on attitudes related to inclusive education. We tested several versions of questions related to attitudes. And to our regret, unfortunately, we had to come to the conclusion after 10 years of testing that these questions on attitudes do not work well. They are very difficult to respond to. Respondents have a hard time understanding the questions, relating to the questions. They give an answer, but then they come back, and when they have the opportunity to think about the questions, they tend to change their responses. So there is no coherence, in other words, between what they are reporting, what they're actually thinking, which defy the principle of asking about attitudinal questions are indicative of behavior. So we had to come to the conclusion that these type of questions are really not meaningful because they do not produce high quality data. In terms of the next steps, we are now gonna wrap up the analysis of the different testings that I mentioned, and we are gonna be ready to release the module in June of 2024. The module will be released together with the guidelines for interviewers, as well as other supporting documentation that are critical for providing support to the teams that need to implement the module in surveys. So thank you so much. I'm going to stop here. And of course, I will be happy to answer any question you might have. Thank you.
Thank you so much, Claudia. It's hard to believe it's been 10 years that we've been working on this module, but it's really great to see it coming to a conclusion and having a product that we can share this spring. And I think interesting how the attitude questions just didn't work. And I think that's kind of a product in itself, just trying to explain why that happened. I am looking in, whoops, the wrong thing. In the chat, I don't see any questions. Do we have any comments or questions for Claudia on this module? Again, really trying to get at that interaction between the child's functional ability and their school environment to see whether or not they are thriving in school. So really filling out the that's ICF social model of disability, which, as we talked about yesterday, is kind of where we started. So this is really a major major step in that development, and very similar in this much more extensive, but the idea very similar to the ILO module that looked at some barriers and facilitators to work with. This module is much more comprehensive. Claudia, you were perfect because I don't see any questions. Oh, how many countries are currently following this CF? Rajan, I don't know what you mean, the CFM. How many countries are currently using the, oh yeah, the CFM module?
So far we have more than 50 countries with that have conducted a household survey, including the child functioning module. I cannot give an exact numbers because this number keep increasing every week, but we have at least 58 so far data sets released, mostly through the multiple indicator cluster surveys that have been conducted across the world, but also in some cases through dedicated disability surveys.
We expect that once this module is released, it will be, this inclusive education module will be released, it will be used. I can attest that the Washington Group Secretariat was getting a lot of requests for the draft version of the module. And I know that UNICEF got those as well. So people were wanting even the draft version because they really felt the need for this. Another question, Claudia, how is it thought to interact with MS?
So in the case of IMIS, we have tested the inclusion of some of these questions in IMIS as well, but these questions are mostly meant to be administered to mothers or primary caregivers. In the case of IMIS, you have the perspective of the school administrator, the school personnel that might report on some of the common aspects related to the topics that we are capturing. For example, in the module on school for children attending school, there are questions about the premises, right? The accessibility of the premises, the number of desks. But this, in the case of the inclusive education module, we're offering this through the eyes and the perspective of the mothers or primary caregivers, while in the case of IMIS, these questions are provided directly by the school. So using this question together is actually a good opportunity to triangulate the information that you might get from the supply side, which will be the IMIS, as well as from the demand side and the user side, which will be the perspective of the inclusive education questions.
Interesting
Clara?
to see whether
Clara.
the supply people agree with the people, with the parents on what is actually available in the school. Claudia, can you answer Clara?
Yes. Clara
And
is
maybe
asking,
translate it into English
yes,
for us?
Clara is asking, there are more than 58 questions and the module can be very long. Are you considering shortening it? Believe us, Clara, we always try to make the modules as short as possible. Huh? We are coming from the same perspective of national statistical offices, but these 58 questions are not meant to be administered for all children. As you can see, these children belongs to different categories. So a child is gonna be either ask questions related to school participation in a school setting for those who go to school, but of course the same child will not be asked questions for being out of school. So you shouldn't add these questions because the same mother might be asked a subset of this question depending on the school profile of the child. The only module that is really meant to be administered for all children is the one on school participation, because these determine really the profile of the student. And at first, we were not even planning to have this module on school participation. We were relying on the standard set of questions on education that you can find in a household survey. But then we realized that those questions are not able to give us the granularity that we need to understand the student's profile. And without this information, it does not make sense to ask the follow-up module. So we need to build the profile of the student first, or the child, whether it's a student or not, and the type of school that he or she attends, and then be able to administer the other questions. So we do recognize that in any case, each mother might probably end up receiving something like 20 or more questions. That's the minimum will be a little bit over 20 questions. But unfortunately, if we really want to cover all the aspects that really count, all the possible reasons, all the possible elements in the environment that are important, we need to ask all these questions. Otherwise, we will be partial in covering all the features of the environment that might affect school participation.
This, a similar question, I think it's from Yaza. Can countries administer specific modules?
Again, the first module really has to be administered by all, in all cases. If a country has very high level of school attendance, for example, the proportion of children who will get the questions about being out of school will be very minimal. So if the children are not out of school in a country where you have extremely high level of school attendance that reach 99 or 100%, there is of course no need to ask the question on school, out of school. Similarly, being homeschooled might not be a reality in most countries, for example, so you can drop some questions. We are going to provide guidelines on how you can customize these set of questions going forward, which include also consideration for prioritizing certain questions or certain modules over others.
Okay. So, any other questions? What about caregivers with, whoops, moved.
Okay, Suzanne, in terms
Yeah,
of,
thank
can
you.
you see the question? So what if a mother has multiple children of school age? Will they answer for a specific child or the youngest or in general? Whenever we want to, for instance, minimize the number of questions that a mother is asked, we can always use one child instead of asking about every single children. Now, this will reduce the number of observations that you're going to have, but we will never recommend asking the youngest or the oldest child because this might introduce a bias. So instead, the best approach will be one randomly selected child per household in that age group. Because if you choose the youngest one, for example, you might only, because of financial constraints, prioritize school participation for the oldest child. So instead of introducing a bias by picking up the youngest child or the oldest child, it's recommended to do a randomly selected child in the ages of school age if you want to alleviate the burden on respondent.
And then Claudia, one other question. Do you suggest to apply the inclusive education module and CFM in surveys?
Well, if you only apply the inclusive education module, you will not be able to disaggregate the results coming from the inclusive education module by disability status. So if you really want to disaggregate and look at, for example, the school experience of children with disability and without, then of course you will need to include both modules. If you only care about understanding the proportion of children with functional difficulties, of course, you only use the child functioning module. So if you really want to have a comprehensive set of information, indeed, you will use both, because by using both, you will be able to disaggregate the education-related indicators by disability status.
And we generally recommend using the CFM in all surveys which you have any outcome indicator that you want. It is not just to get the prevalence and characteristics of the population, but if you're doing a health survey, you would put them in to look at disaggregate health outcomes. If you're whatever survey that you're doing for the outcome part, you should include the CFM for children and the one of the other Washington Group tools for adults. That way you'll always be able to do the disaggregation. I don't see any other questions in the chat, Claudia. Thank you. Perfect timing. Congratulations on
To us all.
yes, but particularly to UNICEF for really persevering and making the structure possible for all of this testing to be done. The folks at NCHS and the Cognitive Lab helped a lot in this testing, but if the countries hadn't agreed to do the testing, there is no survey. And that's true for all of the tools that we reviewed yesterday that have been developed as part of our collaboration, whether they're for censuses or adults or for children, without the country participation doing the testing, so that early on we knew we were going down the wrong road here, and we needed more information about what the status of the child was in terms of education in order to do the questions. Really, we wouldn't have gotten here. So I look forward to seeing the final version of this, and we will have a party.
Yes, indeed.
Thank you very much.
Thank you. Bye-bye.
Bye. Okay, and now I'm going to move to the next session, which is session 6. Now, this is very different. The CFM TV session, Claudia's presentation, and a session we will have tomorrow are still in that realm of Washington Group work in questionnaire development, testing, and documentation. Claudia mentioned that when this comes out, there will be interviewer guides, there will be specifications, there will be guidance in how to use it. So that has been a huge part of the last 20 years of work, trying to develop these questions in a conceptually consistent way, test them, document them, provide technical assistance. The other side, though, is once you collect the data, what do you do with it? And while all countries who are collecting data have their own mechanisms for disseminating data, whether it's in a file or a report, and they will do the reports that are traditional in their country, there is this push for internationally comparable data. This is the SDGs. That's all it is about, is internationally comparable data on agreed upon outcomes. And as you know, the SDGs had a big focus on leaving no one behind on the disaggregation. I always think, like, disaggregation is the Washington Group's middle name. This is what we do. So several years ago, we also started pivoting away from just question development to how do we best deal with analysis. That's why you have all those documents on creating the indicators, on the syntax, analytic guidelines, and that was a big step. But now we want to take the next step and facilitate the availability of comparable data across our member countries using the tools we've all developed. Now, there are others who do this. There was a report comes out periodically out of Fordham. Many of you know Sophie Mitra, which takes all the available data and tries to put it together in a consistent format and does a report. UNICEF does this with their mixed surveys. Since we are, remember, country run from my slide yesterday, we want the countries, our own countries, to be developing the data products that are comparable and can be used in an international setting, such as the Global Disability Summit. So this next session, Julie will give, you have heard about this in the past. This is not necessarily absolutely new, but we do want to move forward in the creation in a big way. We're not talking about 1 or 2 reports here, in a bigger way of the standard analytic country report on disability, and do this in the next year or so, so we're ready for the summit. So over to you, Julie.
Thank you, Jennifer. Greetings, everyone, again. Yes, I am going to talk about these country reports on disability. And for the most part, I recognize so many of you here in the room in the meeting today. Thank you again for joining. You have heard this in some form or another, but I do want to run through the reports again. I want to talk about the history a little bit. I want to talk about their structure because they have a very specific and standard structure. And then I will address some of the supports that are available to countries to help produce your report. And I will circle back at the end to talk about why are we having this push right now and what the opportunity is to present a body of country reports that are similar and standard and use the short set in a global way. One of the things that I invite you to do today is enter into the chat any thoughts that you have about producing these reports, as well as whether your country is ready to produce those reports, and there will be an opportunity to add to that discussion tomorrow. The other thing that I want to mention is that when we go into next session, session 7, which is a breakout session for the regional groups, one of the things that we would like you to talk about is producing these country reports in your countries in the regional environment. So you'll hear more about that in a minute, but let me start by taking just a step back and refreshing your memory about these country reports on disability. One of the first things that I want to mention is that the Secretariat sends out an annual questionnaire. It is an Excel spreadsheet, and it asks our members, how do you use the data? Do you use the short set? In what form? Is it a census or a household survey? And for many of you, you have responded and filled those reports out already this year. Thank you so much. But that Excel spreadsheet, that survey of our members is not the country report that we are talking about here. So I do want to make that distinction because sometimes it's easy to get confused. Well, I already report every year to the Secretariat, and that's not what we are addressing here today. So as you heard yesterday, and as you already know, part of the Washington Group's mandate is to not only develop these question sets that we continue to do, but to support implementation of those data sets and dissemination of the data that are captured through those sets. And for the most part, many countries have implemented the short set on functioning, and that's the most common set that will be used, especially in the context of the recent 2020 round of censuses. So this decade of censuses is really, it's a watershed moment for the short set. It has been part of a country census in many, many countries. So we're coming to a place where we have quite a bit of data that are collected using the very same question set. And the idea here was, how do we disseminate this data? And in our 2019 meeting in Argentina, the decision of the members was to disseminate that data via a standard report. Another option that had been discussed was creating standard tables, similar to what the UN Statistical Division requests each year. But because that initiative is going on, and those tables were something we kind of wanted to do something very different. The membership decided on this report. And the idea also is, if we can produce enough reports, then we will place those reports as a body in a very specific area of the Washington Group website to be available to anyone. Also discussed during that time was, what would these reports look like? It was very clear that we wanted those reports to be fairly short, 2 to 4 pages, maybe 5 or 6. It depends on what a country decides to put in their report. But for the most part, the body of the report would include standard language, standard figures, and a very similar approach, at least at the beginning of the report, to what the content would be. And then after that, there would be space for countries to add any country-specific figures. So those country-specific figures would not replace the standard language or the standard figures up front, but could be added in addition to the ones that are already decided upon in terms of these reports. So over the past several years, a number of decisions have been made regarding how to go about producing these reports and what some of the best practices are for their content. Again, one was to use a very standard template that would include standard text, standard figures that show in part disability by certain socio-demographic characteristics. There would also be other figures using disability data to disaggregate several specific outcomes. And again, there would be additional space if countries choose to add their own additional figures. The idea, of course, is to use the short set so as to make it comparable across countries, and to use the recommended dichotomous definition for with or without disability. We would first calculate prevalence in 10-year age groups, and these reports generally would focus on the adult population. So in many countries, the short set is only administered to adults. So including children was either not appropriate necessarily for the short set, but also not done. So these reports would by and large be about adults. And then we had work groups to address, should we, and if yes, how would we age adjust those prevalence estimates? And we do have guidance on that. And you heard at last year's meeting the decision to move forward with age adjustment of these prevalence estimates that would be produced for the reports. Now, I've mentioned several times that there are standard figures. The first figure in the report is prevalence by age group. The second figure is prevalence by domain of functioning. So this is hearing, seeing, walking, all of the 6 domains individually, and also by sex. And then there are 3 figures where we use the disability data to disaggregate an outcome, and those outcomes are education, some measure of income or poverty, and then the third measure would be employment. And I have these domains here in red because I want to specifically make the notation that across countries, what categories of education you use or what types of measures of income or poverty or even employment will vary. We already know that that is the case. So in these 3 figures, you would use your country equivalent of the standard categories of education or income and poverty or employment for those figures. Then you would add any other country-specific figures, as I've mentioned several times. So these are the best practices for the country reports on disability. And now I'm going to walk through what they look like, given that we have produced 2 so far. So, excuse me. This is the country report using United States data. And this is page 1 of that report. And if you've heard our presentations previously on this, you know that page 1 is standard. There's nothing about this first page that needs to change from country to country, other than, of course, the language. The sections cover the importance of disability, the definition of disability, the conceptualization, as well as the Washington Group measure. So there's nothing about page 1 that needs to necessarily change. That's a standard page. On page 2 of the report, some space is devoted to talking about the data from which the figures are based. So here is a short description of the data set that is used for the US. And then there's another short paragraph talking about methods. Again, this can serve as a template, but of course, in each country, the information that's provided in this brief section will differ slightly depending on what a country wants to report about its data source and its methods. Following that, we move into this first figure, which is very simply total all disability by age groups. So this is the prevalence of any disability using that standard cutoff by age groups. And you'll notice that right above the figure are very high level bulleted text, which is simply where there are findings to report in terms of differences or patterns. They are reported in these bullets right above that figure. So by and large, page 2 of all of these country reports will look very similar to this because the data and the methods section is brief, and more than likely we'll be able to get that figure 1 on page 2. Now we move to page 3, and here we have that second figure, which is the prevalence of disability by any disability here, men, total men and women, and then the separate domains of disability. Again, we have these standard bullets, short bullets up here reporting out on some of the findings from the figure, the patterns that are seen. And that concludes the section on disability by sociodemographic characteristics. Again, countries may add to this section, but those 2 figures are the standard figures that we'd like to include in all country reports. Following this on page 3, then we move into this section on outcomes disaggregated by disability. And there is some text describing disaggregation and the importance of disaggregation and what that is. And for the most part, again, that text can be copied from country to country. And then we move into those 3 charts that I've already introduced, which is education, some measure of income poverty, and then employment. So moving on to page 4, in the US report, our figure 3 shows disability by educational attainment. And these are for the United States, the common categories of educational attainment. In your country, those categories may be different, but the figure itself will be very similar. And again, 2, 3 short bullets above the figure reporting on the patterns seen. And then we move right into family income, which is the economic measure that is used in the United States. Here are the bullets. You can see that sometimes we can't fit those figures all on the same page. So the bullets are here, but here is the figure. And when you're reading the actual hard copy report or even the electronic, it's not quite as problematic as it might look here. Here is the very simple figure of disability by economic category. And then very quickly, here is our employment figure, employed and not employed. So we chose a category, very simple dichotomy of that. And in fact, there's only one bullet here reporting findings or patterns about this figure. So that concludes the content in this report. Again, that is fairly standard. We did want to add a few things in the US that we had available to us. This report continues on to other pages that show the trend over time. One of our major national surveys captures the short set and has included it for 10 years. So on page 6 of the US report, you will see other outcomes disaggregated by disability. We have immunization, for example, and then we have a figure showing the long-term trend of any disability, as well as the trend lines for the specific types of disability. I don't have a picture of here, but I'm happy to disseminate this report after the meeting so that others can take a look at how it looks. As I mentioned before, we have a number of guidance documents that have been developed to assist countries in producing a report. One of the things that is not listed here is a slide set that has been created, if you're giving a presentation, taking the audience through step by step what to do to produce one of these country reports. It's much more detailed, of course, than what I'm providing here. And the document that accompanies that is the first one mentioned here, which is the guidance for creating a Washington Group country disability report. That document is available in English, French, and Spanish, and it is a comprehensive step-by-step instruction document that takes the reader through each page of the report, provides all of the stepwise information about how to create the dichotomous indicator, how to age adjust or when, and include both graphics as well as examples. We think it's pretty comprehensive and are happy to receive feedback about that if there are places where it is not. but it has been used by several countries so far. So I think that one is in good shape. We, of course, have a document about creating the dichotomous indicator of disability. And that document also is a stepwise guidance document. It includes the programming language steps that can be simply lifted straight from the document in SAS, Stata, SPSS, and R. And then the third document is our best practices for age adjustment. And this is the document where we show you how to take those 10-year prevalence estimates for 10-year age groups and apply the standard world population that has been chosen for this project, and it's even given in the appendices, and create age-adjusted disability estimates. And again, documents 1, 2, and 3 are available not only in English, but also in French and in Spanish. And then two reports have been produced so far. I've certainly mentioned the United States, but the Brazzaville group has produced one, or Mali has produced one with the support of the leadership in the Brazzaville group. And we have that one, which was produced using all of the guidance mentioned here in this slide. So Jennifer teed up the idea of the Global Disability Summit. Before I turn to that, we do want to put these reports onto the Washington Group website. We don't want to do that until we have a body of documents. It doesn't seem to make a lot of sense to put 2, 3, 4 country reports up on the web. But once we have quite a few, then we will create a page and have those there. But I do want to turn now to the 2025 Global Disability Summit. If you have not heard about this meeting, the thing to note is that it will be held in Berlin. It's going to be in April of 2025. And the meeting will be sponsored this time. This is the 3rd Global Disability Summit. It will be sponsored by the International Disability Alliance, by the governments of both Germany and Jordan, who are hosting. And in discussing with GIZ, the Global Disability Summit plans, there has been this idea of potentially having a data session where these reports could be highlighted if by that time we have created a sufficient number of reports. So these could be the focus of a data session, and what we are hoping to do is to interact and dialogue with you here about whether you foresee your country being able to produce one of these reports and can do so in, let's say, the next 12 to 18 months, because we would want to be able to produce those in time to kind of organize a session around those. So we'll talk about that later. Moving forward, I can foresee that in the regional groups themselves and on a more regional basis, these reports could be used to, be sessions in conferences in the local areas to really address issues in disability and to compare across countries. So as a body of work and as a product out of that, we are hearing there is a need for this, and we foresee that there is the possibility that these could be used in ways that we're not already thinking about. So our big question to you is, how can we support countries in producing these and beginning to think about this project with the data that you have collected? And in session 10, we're going to have some poll questions that ask the following. So in light of these discussions, and in light of the discussions that you will have in your regional groups momentarily, we will come back on day 3 at the end tomorrow, and we will ask, is your country able to move forward with producing a country disability report? Should the Secretariat organize one or more webinars that focus on the production of these country reports? These webinars could be very specific and held with a country's staff who are working on this, or we could do it for a group of countries or in a region. It would give the attendees an opportunity to ask very specific questions or get information, especially if there are any barriers to producing your report. Question number 3 would be, should the Secretariat connect countries with other experts or consultants who can assist them in creating their report and doing the analysis? And finally, should the Secretariat act as a clearinghouse for these reports produced and use them to report out at the 2025 Global Disability Summit? So these are some of our prompts. Please be thinking about that. As I said, it would be lovely if you use the chat to kind of send out some of your thoughts about this particular project and what you foresee as some of the opportunities and challenges in your country. I can hear an interpreter again, so I apologize for stopping. Okay, that's it for my presentation. I am happy to take any questions or address any thoughts and ideas. Suzanne put into the chat that she's having a hard time finding the guide and these 3 documents on the web page. Right now, they are not on the web. I am more than happy to send them out. In fact, I can do that as a follow-up to all of the members, but there are some key decisions to be made here in terms of moving forward. So they're not yet on the web, but I'm happy to send them to you. Anyone want to come in to share some thoughts or ideas? And I can't see if Steve is here. Steve Mboko is the lead for the Brazzaville group. Maybe he has thoughts on how easy it was to produce the report in Mali as well. Netta has put into the chat. ESQA has all the national data and can support countries in preparing the reports. Thank you, Netta.
And Julie, if I could just add quickly, I think that we think that regional groups are a good way to for countries to get together to do these reports. So that's why we would like you to discuss it in your regional group meeting, which will follow this session. A couple more in the chat, Julie, if you can see them.
I can, so let's take Rajan's comment first. Rajan is saying that in Nepal, they do not use the short set in their census. So it might be risky if NSOs produce one of these country reports based on a different data source. You're absolutely right, Rajan. The idea here really is to use the Washington Group short set. Now, if a country has administered the short set in a data collection other than the census, so either in a national health survey or your living standards survey or somewhere else, and it's nationally representative data, then of course we can, I would encourage the report to use that data. And certainly in the methods section on page 2, you would indicate what survey that was from and what the population represented by those data are. So yes, I think that's a good point, where these reports might not be comparable if they are produced using different data.
I think one area where they might not be comparable, but it's okay, is the source you're using may not have those 3 outcomes in them. It's generally, those are pretty standard. They're almost in every survey. You get something about employment, education, or income, which is why we pick them. They're not necessarily only census items. But if, for example, you only have it from a labor force survey, which means your age range will be more restricted, and you may not have one of the other items, then that's fine. I think you just document it. I think right now our default is do a report with the information you have available, and just document how it might change, how it might differ from the standard report. But right now we'd like to get as much as we can.
Mm-hmm. Clara added a comment, and I cannot speak Spanish. I can read Spanish a little better, but I still may not get this right. So someone may have to help me. But I believe Clara is asking, should the reports use only the most recent census data? If I'm misinterpreting that, please someone let me know. Certainly we would want to use whatever the most recent data that a country has, but in certain circumstances, the best data or source of short set data may be captured 2 or 3 years ago even. And it's not necessarily from the census, as I mentioned in my response to Rajan's comments. Clara, please let me know if you wanted more information and I didn't address that. Steve, you want to make a comment? Please feel free to come in.
Okay. Thank you, Julie. And I just want to speak in French as there's in interpretation. I don't know if if you are okay with that. Can I speak in French to be more understood?
Yeah.
Is it possible?
Yeah.
Okay. Yeah. Great.
Oui.
So my comment is about the question of Rajan, and she is talking about let's say two data sources, the population census and a survey. So the problem is all about the population structure. If we have a population coming from a survey, I think it's more difficult to produce a disability indicator and to compare it with other countries or a population census, for example. That is the reason why we should use the standardized population, which is given by the Washington Group. The Washington Group has produced the population standards. It's a population structure coming from the population UN population division, where the standardized population is taken from. So my advice is, even if you don't have a population census, it's better to standardize all your indicators that will be produced for the country reports. So there's the the file used for the standardization is a little bit tricky, but you have to be to well master the Excel and to see how it works. All the very difficult work is to deal with the Excel and how to master the production of the standardized disability indicators. So that's the comments I wanted to make. Thank you.
Good point, Steve. Julie, do you see the comment from Malaysia?
Yes, Malaysia as well as Liberia have indicated that they would like to have the documents and in the case of Liberia, training to produce a report. And Riaza, thank you so much for mentioning that the Maldives can move forward with producing a report using the 2022 census data. Diana, please come in. Diana, can you hear us? We cannot hear you. That might, maybe it's a mistake. An old hand.
She's coming. She's
Oh.
coming.
Thank you. Thank you so much.
Coming.
I am not going to be able to translate the comment from the Dominican Republic. That is a little too hard for me. Tamara has done that. So while we're waiting for Diana, there's a comment, another comment. We considered of great support that other countries can share their experience in the elaboration of the disability report. In the case of the Dominican Republic, we are just doing it with the results of the 2022 census, in which for the first time the Washington short set was used. Thank you so much. Yes, I think one of the helpful things would be not only to share these reports that have been produced already, as well as the guidance, but to also share experiences from those who have done that. And we are here, you know, to help do that. So we will take that into consideration and try to see how we can provide kind of that experience from those who have already done that. Maria is asking, what is the ideal deadline for sending the report, and can it be presented more than one research in the same report, or would we do separate reports if that's the case? I'm not sure that I understand presenting more than one research in the same report. If you mean, maybe you could provide extra thoughts about that. But in terms of the ideal deadline, what we are hoping is to have many of these reports produced, you know, by, let's say, at this time in 2024, maybe late summer, 2024 summer, North American time, in order to be able to decide, do we have enough? How do we put this session together? You know, how can we submit a proposal to GIZ to include a data session at the GDS? some decisions can be made. If we know that you are working on it, we're helping you to produce it, then obviously, we can plan earlier. But in terms of having them done, one of the things that we are considering is trying to format them in all the same way, and that may take some time. I know when I was doing the US report, I don't have kind of graphics software to make things look exactly the way that I would like them to look. And we have thought about maybe having some work done by a company who can really standardize the way they all look and package them so that they look a little bit more consistent to each other. So, 2024 is what we are shooting for, but probably mid to late summer.
Next
Go
year, I think, Julie, you're right. I think a year from now would be ideal to have them. If you're working on it and it's going to be another month, that's fine, that's okay. But we do want to have those discussions with GIZ about the session. And they, I think also, if there were enough of them or enough from a region, would want to combine them in some way that we would have to get help to do. We couldn't do that ourselves, but have the individual ones, but then also have maybe sections, like pull sections from each one of them so you could compare across countries on prevalence or things like that. So we're hoping that from now until this time next year, this will be kind of a major activity that we would be interacting with you on. And the more interaction we can have, whether it's individually with countries or through the regional group, or if you're not a member of a regional group and you want to get together some other countries in your area, form a little mini regional group just for this, we can arrange that as well.
Daniela, do you want to come in and chat?
Hola, buenos días. Voy a hablar en español. ¿Cómo están? Un gusto saludarlas. Desde la CEPAL, como estamos apoyando al Grupo de Buenos Aires y a los países de la región, nosotros podemos apoyar en esto que ustedes están proponiendo de estos reportes nacionales. Entonces podríamos conversarlo con el Grupo de Buenos Aires para ver cómo seguimos trabajando con ellos en esta instancia. Gracias.
Wonderful. Thank you so much, Daniela. I think the breakout sessions will be a good first start for discussions around these. There was another chat.
Julie, sorry, did you see that? I think it was Clara added to her question about more than one research.
We have more than one survey with data with disabilities. So first of all, how wonderful. And assuming that is all that the same question set, the short set, is included across different data collections. One consideration is the data collection that has the other outcomes that are part of the standard of the report, but any other outcomes that you might want to report out on. I have to say that, we haven't specifically addressed the issue of what is the best data source. So I would have to know more about those different data collections, and a country could, let me think about this. I don't want to say, I haven't really, I'm thinking of a situation where if you do more than one report, and thinking about that first figure where you're reporting out prevalence, you can have differences using the same questions across different data collections. So that would be problematic. In the US, I think, even our census produces slightly different numbers than other data collections using the same questions. So it may be up to the countries to determine what's the best data source to report out the national level of disability. In many cases, that's going to be the census. But I think we might want to chat more about that offline. Steve, did you come off of mute because you have another intervention?
Yes, I wanted just to comment about the data sources, the one you have been explaining just a few moments. So to me, I think that it can depend on the date of the data collection. If the data collection are carried out, let's say, 1 or 2 or 3 year in the period, the interval of 2 year or 1 year, that can be good to see how the things are moving on, talking about disabilities, to see we can compare the level, the disability indicator have been in 1 year before the other survey or census have been carried out. So it can be a good way to compare the evolution of the statistics. So just that is the comments I wanted to add.
Thank you, Steve. You're right. I think one of the value reports would be to compare both across country, but across time within a country. One of the reasons why the US included a chart, a figure showing the trend. But in general, we would want, you know, the body of reports to be as recent as possible to really be speaking to, you know, mostly a very specific time period, say in the last 3-4 years. It depends on maybe when the data was collected. Some censuses start earlier in that census band. I see another.
You have a question from Riaza. Did you lose that one?
Yeah.
What about the detailed disability report countries prepare based on the short set? Would you be interested in having those reports up on the Washington Group website?
So, Riaza, I assume what you are referring to is your NSO's report out dissemination of disability statistics using the short set. Is that if that's the case, yes, we are happy to add that to the website. We do already have a place on the website where we have publications. But if countries have just released a disability report or a report containing disability statistics, we also would be happy to put that in as a news item. You may have seen that we've done that with some of the large reports produced in the Esqua region. When those have been produced and released, we've tried to feature those in our news. So we are happy to do that and then keep those in the list of our publications.
I was just to kind of add yes, please send us what you've produced. We could at that summit, in addition to showing these standard reports, also have a way to highlight the country-specific reports, you know, that they do on their own as part of their own statistical release. We could maybe, you know, provide that in a document listing everything. or highlighted in the presentation. This is what we have, kind of what we do at the beginning of this meeting, where we kind of go through. We have 50 reports, detailed reports from regions or countries. So we could highlight it. We can only highlight what we know about. So I would err on the side of sending us any reports you do on that have disability in them. And then we may not, there may not be enough disability, although and the word is enough to put us generally for us to look to put it up, but just send it to us, because I think we could craft something out of whatever it is that you are producing that we don't know about in terms of this summit. I would like, I guess personally, to use this summit to kind of show the amount of progress countries have made in collecting and disseminating disability data since we all started on this path. Because every report you see says, starts with there's no data. And I think that that's not quite true anymore. There are data, they're just not used. And I think what we'd like to do at the summit is to show there's a lot of data out there and countries have it and are producing it, and you've got to kind of pay attention to it. So there's a little politicking going on here, but I think it would be useful if we can do that. But we can only do it if we have the, we have to have the stuff to show that, yes, that it's being collected and it is being published by the countries and it's available, and you should be using it. Uganda, the question's in the chat there. Julie, do you see it?
I'm scrolling.
I'll read to you.
Go ahead.
Uganda intends to produce the country report basing on the DHS 2022 survey that included a module on disability using the Washington Group short set.
Thank you. Also, Monica also added a chat about Hungary being able to produce a country report using their 2022 census data. And Netta added something in the chat that agrees with the comment that Jennifer just made, that there are data available, in some cases, several years worth of data, and they are coming from different sources. Jennifer mentioned in the opening session that it's getting harder and harder to track where data, where the questions have been used, where data are being produced, and where they are being disseminated. And that is very true. And I would very much appreciate, I'd like to invite you to send to us throughout the year either your own reports, your own dissemination products, or any that you come across using the Washington Group tools. It really is the only way we can do a better job of keeping track. We'll never get it 100%. But we know that you are busy. We know that you are successfully disseminating the data that you have collected. So we would like to know specifically about it. So I invite you to send to me, the Secretariat email, any information that you have as you produce these things.
Follow up on Monica's comment, Monica. It's a good suggestion. I think, we've kind of had little bits of communication here and there, but certainly the Secretariat can create a mailing that has all of this information and how to do it and examples and everything we've had, everything that Julie's talked about. What we're looking for tomorrow, but if you want to tell us today is fine, is that sufficient? I think, it may be that's it. If we just sent you all of the documentation, you could do the report. Or would you like to have some kind of webinar where we kind of go through this stuff in a little bit more detail? Or should there, I was thinking for the next year, we said we would like it in a year, we could kind of schedule a monthly kind of question call-in for as you're working on your reports. Someone would be available to answer the questions. And as you said, there are some consultants out there that GIZ has funded to provide assistance. If you would like that, we could put you in touch with those people. So I know that there is no regional group in Europe. So for you guys to get together where we know that some of the other regional groups are focusing on this. We know the two African ones, Buenos Aires, Casablanca, that there is movement at the regional level. Not all countries are in a regional group. US isn't in a regional group. So if there's another way that you'd like to connect, we can do that just around this project. But we really are looking for feedback from you, because sometimes we think we're coming up with a reasonable idea about how to do something, but it's not really what you want. And we just don't have any way of knowing that. So you can call us later, you can put it in the chat, you can bring it up tomorrow, however you want to do it, but we'd like to hear back. Julie, there's a comment from Sweden, do you see, from Suzanne?
Sweden will have, in April of 2024, their data from 2023, and will be able to produce a report before summer with no need for support or assistance. Again, if they receive the guide, and we will make sure that these documents are sent out. Rajan asks, is it possible to ask the heads of the NSOs to prepare a brief country report of disability statistics when they go to participate at the annual meeting of the UNSC? Is this question appropriate? Jennifer, you know more about
Okay,
what
so
happens at UNSC, especially
just-
this coming year.
Yeah, a little bit about the commission meeting and how they're run. And I haven't, when I was still at NCHS, I was very involved in the commission, but I haven't been since, but I'm assuming it's pretty much the same. The agenda at the commission is always very full, and I forgot, the bureau of the commission, along with UN, the statistics division, kind of creates the agenda and puts the reporting into two categories. One is a discussion item where whoever is in charge makes a short verbal presentation to the commission, in addition to having a written document that's provided beforehand and translated and all of that stuff. They make this discussion. It's usually several minutes, not much longer, where there are very specific things that they're asking the commission to do. Then they open it up for comment. Now, sometimes they ask for the comments beforehand, but in the old days, it was all kind of done on the floor. And at that point, in some years, when the Washington group was on the agenda, which we are every 2 years, NSOs would, in their response to the Washington group report, would say something about the disability data collection in their own country. That was the opportunity. Otherwise, there's no opportunity, as far as I can tell, for this to happen. And some of you who are more old timers will remember that right before a commission, we would send something out to you all saying, tell your NSO director there's going to be a report on the Washington group. They should be supportive. They should say, endorse the work plan. They should say how it's benefited you, blah, all that kind of stuff. And many of you did, and that was very appreciated. And that's the way it was for the early years. And in fact, I think we used to go every year for a while. We reported, then we went on a 2-year cycle, which I think is the standard. About, I don't know, it might be 6 years ago, maybe more, we got moved to an information item, which means that we still write the written report to the commission. And at the end of that, there is something the commission is supposed to do, but it's usually like the commission is invited to take note of the report and agree to what it says, things like that. the way that UNSD has done this for disability, which we did not agree to. I mean, no one asked us if this was okay. We were told by UNSD that this is the way it would be. It is not a Washington Group report. It is a report that combines all work on disability done under the UN. So UNICEF has a section, WHO has a section, the regional offices have sections, ILO would have a section, UN Women can, whoever wants to have a section has one. And there's a page limit. And so they take the number of pages and they take the number of people who want to say something and they divide it. And that's what we get. And I think we have 1,700 words this year for our part of that joint report. Because it's an information item, it is not presented. So no one speaks about it. It is just sent to the members. And then when they were doing this virtually during COVID, it was a little bit different. I don't know what they'll do this year. There was one session at the end where all comments on any information item were taken. So there might be 8 information items, and it's just like a random, people just made comments. There was no structure to it. They didn't take all the disability comments at one. Whoever raised their flag, they got to speak. What was important there is that none of those comments are captured in the report that comes out of the commission. So the report that comes out at the end of the commission, which is what the commission agreed on, is only on the discussion items, and there's no agreement about the information items, so there's nothing captured. So you're kind of definitely flying under the radar at the commission. I don't know if it's worth it to ask the head of your NSO to do anything, because I'm not sure when they would do it. They would have to kind of find a time to make the statement. I personally doubt, given the way these commissions are run, that there would be sufficient number. There would have to be a groundswell of NSO heads that wanted to say something important about disability at this meeting. And I just don't know if that's there. And honestly, I don't know how to do the politics around making that happen. So, I think if you think this is important to do and your NSO head thinks it's important to do, they'll figure out how to get it done. But I don't know if asking all the heads of the NSOs to do this would be very successful. I am, though, open to hearing from all of you that I'm wrong on this and that you would like your NSOs to say something positive about the disability work you're doing and the importance of the Washington Group in doing it. That would be important. I will say one other thing. This year I received something from the chair of the Friends of the Chair, which is another kind of group that the commission has to address issues, that asked, it was a questionnaire about the Washington Group and what we have done and our accomplishments. So it was kind of fortuitous that we were also working on the slides for the first session, so we had a lot of that information available. I'm happy to share the responses to that if you would like to see them. A couple of years ago, the commission was thinking through if it wanted to make changes in the structure of these groups. There are city groups, Friends of the Chair group, expert groups, ad hoc groups. There's a lot of different kinds of groups. And they were thinking of maybe streamlining that or changing the terms of reference or something. Nothing happened after that. I don't know if this is the beginning of another activity where this might happen again, where they might say, we're getting rid of expert groups, we're going to only have city groups, or we're going to have city groups, but they're going to be different, or we're going to change the terms of reference. So I don't know. I honestly don't know what's going to happen at the commission. I don't go anymore, so I don't have enough connections. It's just sad. Maybe some of you do to find out. But again, if you think that this is something that you guys want to do as country reps to the Washington Group, that you want to have your NSO highlight this work, then it is something that we can work on. But I really think it has to be a kind of groundswell. It won't make a whole lot of difference if one country says something. I know that was a lot, and I know you asked a simple question, Rajan, so I'm sorry for the long, extended answer, but the workings of the commission are a little strange.
That is true. Rajan says thank you, and I'm going to ask Steve to come in, who also had a follow-up comment. Steve?
Well, thank you, Julie, and thank you all. So I have one comment I wanted to make. It's, let's say, a question I get from the last African Inclusive Conference that have been done in Nairobi, Kenya, by on June, I think on June of this year. And I have a question. They asked me to say, so you are talking all about data, or a good quality data, or a good quality disability indicator. So what's next? What's happened if all countries have produced data and indicators? What's the action after collecting data? So here I just wanted to raise the voice to mention that situation, and yeah, so we can all think about the issue of our data that we are talking about and what will happen. I mean, I think we should think about the political action to do in favor of people with disability after collecting data. So I don't know, I'm just raising my voice and to put the problem on the table and to see what's all we can do. Thank you.
Thank you, Steve. If I am understanding you correctly, my first reaction is that what can be done for persons with disability by the Washington Group depends. Our mandate is to improve the tools, support their implementation, support the dissemination of the data from that. It may be very likely that it's beyond the scope of our mandate to do more, and that it might be up to the NGOs and the organizations of persons with disability to use the data in ways that fulfill the agenda and make impacts elsewhere. Again, that's my first reaction. It can be a slippery slope out of statistics into political action. But if one thing will happen, if every country produces a country report, we will celebrate. That will happen, Steve.
I also think it varies by country and how the statistical offices where these are going to be produced interact with their policy and program people. I agree with Julie, spending my whole career in a statistical office. There's a very clear line about collecting, informing, but not doing policy. But if we don't do the reports and we don't make the data available we don't do the inform part. We don't get it in the hands of the people who are making the decisions and the policies, then nothing will change. So if we can do that, I think we've done a fair amount. And as Julie said, it's amazing once you show the disparity, what other people do on the political side to get it noticed and get something done about it. So I think for our side of the fence is to get the data out there in a understandable form that speaks to the issues, that informs the right issue. And that's why we were trying to pick SDG indicators to the extent that we could for these reports, because there's all this reporting going on in SDGs and all the countries agreed that this was what they cared about. This was the most important stuff. So, but up to that point. But again, I think every country is different in how they deal with it. The idea for us globally is to provide the tool. But certainly we can have a lot more conversation about this moving forward.
I don't see any comments, and we are at 10:15. So I think we might be ready to move to the next session. So let me introduce Nicholas Petresky from Argentina, who will introduce our next session, which is a regional group breakout session. Nicholas.
Thank you, Julie. Thank you, Jennifer. We have a lot to talk within the regional groups. There's a lot of topics to talk, to discuss, and to generate a kind of agreement, or at least some points that we should highlight. So these sessions, as Jennifer and Julie said, are for us to discuss in our regions. We have groups in our regions to discuss with. We have 6. I think we are going to go to different breakout rooms. We are going to be capable of choosing one of the options. We have 6, as I said, the Casablanca group, the Brazzaville group, the Southeast Africa group, Kathmandu group, Buenos Aires group. This is from our side, and the non-affiliate countries and partners, as Jennifer mentioned earlier. We have some questions that we already have in the agenda, and also we are going to see it next, but we have to assign a rapporteur to like highlight some points that we want to share tomorrow with the rest of the Washington group. As I said, we have these questions that in the next slide we are going to see. We have time to do this. There's no formal closing today, so we can have our discussions as long as we want, or at least longer than 40 minutes as we made in the past, so we can express ourselves, we can participate and generate this small report to share tomorrow. And we have, as I said, these questions like a kickoff to discuss within our regions. We can see in the agenda these questions, and also we can take a picture of this as the balloons are there, or take a picture. So we have these questions. Also, we can discuss some topics that we kind of have importance for our region, and also discussions that we are already having today and yesterday about different topics of the Washington group. But as a kickoff, as I said, we can start like talking about the country reports on disability, how many and which countries either have created or could create a standard analytic report by mid-2024. Is a technical assistant needed to assist in the creation of the report for the region or for individual countries in the region, and see what type of assistance would be most useful. Training webinars for the region, technical assistant at a country level, in what format, content needed for this training, and so on. The second question will be what were your major activities since the last Washington Group annual meeting in 2022. The next one will be what major activities are you planning for the next year? For example, how can other Washington Group members or the secretariat assist you in your activities? Should the Washington Group Secretariat arrange a meeting for the chairs of all the regional groups to share what has worked for the regional group work plans and what has not? And as I said before, we can discuss some important topics that happened or the countries want to address during these breakout rooms. So in order to have the time to discuss inside this breakout room, these small groups, I don't know if it's available just now to choose, or how are we going to?
Right, we're gonna, Brianna's going to help us with that, and you should see those options momentarily.
Right. In a few seconds, we are going to see them, and please choose which group you belong to or you want to participate in, and we will see all together tomorrow for this brief session of what happened in these regional working groups sessions. So, well, in a few moments, we are going to be able to.
Brianna, are you able to open up the breakout rooms for us, please?
It's important to notice that
it's-
if we were in person, we would spend a little time moving the chairs around. So this is like something like that.
Very good, Nicholas.
Thank you. I remember when we done it here in Buenos Aires, we had to.
Yeah.
Okay,
Exactly.
I know there, so it's kind of, we can try to recreate that scene, but we are not moving, so it's strange,
Yeah.
but
It's a little strange.
it will happen.
Yes.
Well, now we can. You have the screen, the different groups. You have to click on join. So, well, to all, let's say goodbye, and we are going to see you tomorrow. Thank you.
Yeah, thank you.
Yes, you can have a wonderful day. Talk to you tomorrow. Thank you.
急急忙忙的路过就走了。